Now, amid busy lives and hectic careers, many of us don't start even thinking about having children until we are well into our 30s.
Having kids later in life is just one factor that's helping to boost the global fertility market. It's now estimated to be worth $18.5 billion annually and is growing at 9% a year.
Well, one study estimates that in 40 to 50% of infertility cases, male factors are responsible, which means the issue is obviously within the men's control.
And one startup making the most of this growing market is ExSeed. It's created an at-home testing kit which lets men test the quality of their sperm using an app. There is an app for that.
There is an app for everything these days. Well, let's talk to Morten G, Ulsted, who is co-founder and chief executive of ExSeed. Welcome to you. Thanks very much for coming in. Tell us, first of all, we've heard the facts and the figures, but what inspired you to get involved with trying to, if not fix this problem, certainly help with people that do have an issue?
Sure. So it was actually the idea of my co-founder, who is a PhD researcher in epigenetics and reproduction. So he works with this on a daily basis, both doing studies on it, but also getting in contact with a lot of these men suffering from fertility issues. So he was seeing firsthand just the psychological toll that was there for, because of the lack of home testing available, and basically thought, why can't we automate this? And if we can automate it, why not make use of this amazing computing power we all have in our pockets these days? So that's how the idea actually came about.
So how does it work?
So you have a small device.
I've got one here.
Where it has a microscopic lens that magnifies up to 200 times. So you insert a sample, and then you basically place your smartphone on top, and then we make use of the optics in a smartphone. We pump that into the cloud, and then within just 2 minutes, you're going to have a highly precise result on your fertility potential.
I guess what might concern a lot of people is that they want to have a medical professional involved, and it's one thing having a device, you do your sample, here's a device, but they want an expert to analyse it, to actually say what the problem is and what they can do to try and fix it.
Sure. So first of all, ours is developed by experts, and actually it makes use of the exact same software as you find in advanced fertility clinics. On top of that, we're currently under performance evaluation as a medical device to actually certify exactly how precise it is. Now, I think it's very important to also say that we don't want to compete with fertility clinics or doctors. We want to be complementary to them. So actually what we do in our app is we refer people onwards to clinics if we see any sign that they might need medical treatment or anything else than that.
It's interesting. It does seem to be kind of part of a surge in at-home testing for a variety of things. I was on my social media the other day and I saw somebody trying to sell me an at-home testosterone testing kit, and you get at-home allergy testing kits and things like that. I mean, do you think is it really helpful that people are taking these things into their own hands and into their own homes, or is it kind of fueling maybe a bit of hypochondria?
Yeah, I absolutely think it's a positive thing. It's about empowering individuals to take control of whatever condition they may have. I mean, in a third-party research survey we did of British men, 1,000 British men, it actually showed that 42% of them had fertility concerns, but only 18% of them were considering getting tested for that. Now, why is that? We think that if there was a highly precise analysis available, like what we've developed now, then that figure should be much, much higher.
And how affordable is this?
Each test costs around £30. So our starter kit comes with 5 tests, and then also included in that you actually get a telemedicine module, so you can talk directly to our medical doctors specializing in fertility. And there's a tailor-made 3-month lifestyle program involved as well, where in case you want to improve your fertility, you can actually do so.
Give us a sneak peek. How do you improve it?
So there are different things you can do. It can be straightforward supplementation, so L-carnitine or zinc. A lot of it has to do, the number one culprit would be smoking, so absolutely you should cut down on that. Maybe manage your alcohol intake. Also, some of it is just standard health advice, but the idea is that you should be presented with what specific advice is most likely to have an impact on you as an individual.
Okay. Morten G. Ulsted, thank you very much. Interesting stuff.
Thank you for having me.